Thank you very much. And
I have more to say, Miss.
We've got the whole evening. And we'll turn over to Mr. Mitchell.
Good evening, everybody. I'd like to thank the organizations that were integral for putting this together today. I think that healthcare, we know, is at the top of all Islanders' minds coming up in this election. My name is Tristan Mitchell. I'm a paramedic and 911 officer here in PEI and running as the NDP candidate in District 9, Charlottetown-Hillsborough. At the age of 21, and as one of the two youngest candidates in this election, the other being Aiden Mousavian, who joins us today from District 11, Charlottetown-Belvedere, I see myself as a voice for my generation. As an aspiring young healthcare professional, I'm concerned about the direction that our province is going, especially when it comes to things like healthcare. Privatization is on the agenda of many of the parties seated here today, and we know that the risks involved with putting a price on people's health isn't rewarding. For those living with chronic disease and those interested in growing old in our beautiful province, it's essential that we invest into a healthier future. This is needed for all Islanders today and tomorrow, and that's why I stand here today with Team NDP fighting for a better deal for all of us. Thank you.
So we still have the rebuttals. So Mr. Bell, I'm going to go back down to you. Oh, sorry, Mr. Mitchell, I just checked your... I knew I was going to do that at least one.
That's okay. The Democrats are often forgotten about, and that's all right. Yeah, so, you know, I will first and foremost by saying that as a healthcare worker and as a taxpayer here, I believe in spending island public tax dollars on island systems for island needs. We know that people living with multiple chronic conditions need ongoing access to primary care and social supports. The community health hubs would meet this need with the comprehensive services that support the whole individual and their needs. And we're committed to establishing these health hubs where health professionals such as physicians, nurse practitioners, psychologists, and dietitians work in conjunction with social workers, counselors, addiction workers, and appropriate support staff to provide individual plans tailored to the individual, addressing their multiple health-related issues. And these are also going to be places where community groups and NGOs can also engage with patients in providing them alternatives and support for their care. Just as it takes a village to raise a child, it takes more than a doctor to help Islanders improve their well-being, both mentally and physically. With teams of knowledgeable professionals, well-rounded care will improve the lives of those living with chronic diseases and hopefully reduce the risk of development of chronic diseases in at-risk patient populations.
Thank you very much, and not forgotten. So we will go to our rebuttals. Mr. Bell, we'll start with you.
Yeah, I don't really have much of a rebuttal. Tristan, you're the healthcare professional here, and I think you made a very valid point there in your argument and your answer to that question. And you know, I like your line about, you know, it's not going to just take a doctor that's going to help solve the healthcare crisis. It's going to take that team. So I just wanted to say thank you. Yeah, that's it.
Thank you very much. We'll go through our rebuttals in the same order we took the questions. So, Mr. Mitchell, do you have any rebuttal to add to this discussion?
Yeah, and this one's going to be directed a little bit towards Mr. Bell. You know, we've had 4 years of conservative government that came in during the pandemic, which we know the entire international community was focused on healthcare. There wasn't actions taken to support RNs becoming NPs, to bring physician assistants into our healthcare system. There's been delays on legislating for midwives, and it's interesting with this snap election to see big promises being made in 4 weeks when there was no action taken over the last 4 years to make tangible changes now. Well, I am a strong advocate for universal health care, and I think a portion of that in universal health care that's important is making it equitable and accessible. Every Islander deserves health care where and when they need it, and unfortunately access to primary care has worsened from 2020 to 2022. The number of people on PEI's Family Doctor Registry has nearly doubled, and I find myself amongst those 28,000 Islanders asking myself when healthcare will improve. In addition, Islanders are waiting far too long for specialist appointments as well as surgeries. New Democrats are prepared to make the necessary investments to reduce healthcare wait times for Islanders by addressing the shortage of physicians and nurse practitioners, by fast-tracking the licensure of foreign-trained medical professionals, establishing health hubs where primary care teams provide services to individuals in their communities, and ease the pressure on regional hospitals by implementing and hiring physician assistant professionals into our healthcare team roster. And this can be achieved by investing in things like education and taking action. There are solutions. It's all about who's in government to make those decisions and be accountable for them. Thank you.
Thank you.
And 9 times out of 10, that person has a chronic disease. And that ambulance driver, as you would know, Tristan, sits there and sits there and sits there and sits there until that person is looked at. So that very highly skilled professional is taken out of the workforce.
Thank you very much.
I had lots more to say, but she showed me that right there.
And we're paramedics, not ambulances.
Oh, I'm sorry.
Thank you.
You know, Mr. Bell and I were speaking earlier about the importance of having partisan politics put behind us and start working in a more collaborative manner. I will say, Michele, I appreciate your passion on that, but you know, New Democrat leader Michele Neal did send a letter to all of the party leaders for your party seat here today, asking if they would make a commitment to protecting our already existing public health care services, and not a single one of those leaders stepped up to the plate to make that commitment. So I'm concerned that innovation coming from any party might be a disguised word for privatization.
Okay, and Mr. Bell.
As I said in my opening remarks, I'm here to listen and so I would love to hear the questions of the audience.
Anyone who'd like to go first just to start, and but we'll give each of you 30 seconds. Yeah, Ms. Carroll.
Okay. Yeah, I had the opportunity to present to the committees that both Zack and Michele sat on around the determinants of health, and we know the number one determinants of health is income. The opposition and the government have studied basic income guarantee, and we've studied it some more, and I do recognize that we need a provincial or a federal partner in order to do that. But what I'm very confused about is that the King government reduced their spending for projects invested in chronic disease management. The spending was actually reduced, and at the same time they underspent the grants that allocated to health promotions. So yeah, just wondering about that.
Thank you. Tristan or Zack? Michele? Whoever'd like to go next.
Oh,
Yeah.
did you want to?
Yeah, sure, I'll go ahead.
Thank you.
I think that's a great question. I think we've seen some surpluses, and there's a question as to why there is cutting going on when we know that healthcare is a priority issue. But you know, I'm going to swing it back to you, Ms. Carroll, and I'm going to ask, because I took the liberty today to go over the Liberal Party platform, and when we talk about the social determinants of health, I think that housing is a fundamental one, and I'm a little bit concerned about the platform piece where the Liberals talk about removing rent protections and allowing for landlords to price gouge rent costs on vacant units. If we're going to focus on social determinants of health as a goal for improving chronic disease care, I think we need to look at all of them and not just one section of them.
Okay, Mr. Bell, your turn for rebuttal.
I don't get the answer.
We'll get to the next one.
But at the end of the day, here in PEI, just like across this country, we have multitudes of amazing community organizations and NGOs representing a diverse array of groups, including people who live with disabilities, as well as, you know, BIPOC community groups, and those representing immigrants, refugees, and newcomers. When it comes to sitting down at the table with committees, with decision making, with deciding how to best invest our money, we need to make sure that we prioritize consulting community groups like the many that are here today to be involved in this discussion, because those groups know those people's needs more than anybody. So that I think is an absolute priority and a great question. Thank you.
Thank you, Mr. Bell.
I want to thank everybody involved with getting this forum put together. I think it was a really important forum, knowing the issues that a lot of Islanders are talking about and knowing how terrible the rate of chronic disease is here in our province. I think it was also a great way to see where the parties stand, but also where we all agree. I mean, you said it yourself, there were times you agree with me, and who saw Conservatives and New Democrats would ever agree on anything? And I think it's important to remember that, because going forward, no matter who gets elected into the legislature, majority or minority, we have to work together to get better results. You know, I work as a paramedic here in PEI. I encounter Islanders every single day who suffer with chronic diseases, and I find that individuals and families living with these are struggling to manage them in a ever worsening and challenging healthcare system. We all know at least probably one person living with a chronic illness, be it, you know, our parents, spouses, neighbors, cousins, and the high rates of chronic disease in PEI are an attestament to the failure of decades of government inaction to invest in supporting the social determinants of health. And to create tangible change, just as Michele said, we have to change who we let into our legislature, as many of our challenges have been created by politicians that are out of touch with the island needs. You know, I'm proud to be standing with the NDP team as we're making commitments to invest in fundamental improvements related to people living with chronic diseases. And a part of that plan includes investing island tax dollars into island needs to improve things such as, you know, childhood and childhood development, making life more affordable, tackling the housing crisis, fixing healthcare, creating jobs, and tackling the climate emergency. These speak for themselves and touch on the important aspects of the social determinants of health that we need to improve to create a better statistic when it comes to chronic disease in this province. I encourage Islanders to review our fully costed New Democrat platform and vote for our vision for tomorrow, because together we can create a better deal for all Islanders. Thank you.